Hello everyone, welcome back to my channel. My name is Dr. Jennifer Genty and I am a functional medicine doctor, holistic medicine doctor, natural medicine doctor, and I am also the owner of Wellness Corner NJ right here in New Jersey, where we provide inpatient services as well as telemedicine and virtual medicine. My passion is to really help patients heal the bodies the most unconventional way by using herbs, and we also focus on hormone replacements, weight loss, gut issues, so many things that we need to focus on to really restore the function and repair ourselves so that we can feel our best. So today I'm going to talk to you about my story, my perimenopause story, because I realized as I am helping so many patients like restore the balance the hormones and fight menopausal symptoms, whether they have hot flashes or night sweats or brain fog or forgetfulness or weight gain or hormonal acne, or they have sleep difficulties, they have bloat or whatever, heavy bleeds or PMS or anxiety and depression. But I've realized that I've never really did a whole show or whole talk about my story with perimenopause. So I'm gonna take a few minutes to tell you how I got into this work, what prompted me to really become this hormone expert, helping hundreds of people feel the best by really using natural medicine 90% of the time. All right, so about 2.5 years ago I had a baby. Her name is Shaquelle. She's 2.5, and prior to having the baby I had a son. I had a son 10 years before I had the baby, right? My son is gonna be 13. As of my son is 13. So when I had Shaquelle, my son Gio was 11. Okay, and I went through this whole journey after my son. I healed my gut. I had fibromyalgia. I had a lot of bloat, a lot of constipation, chronic fatigue. So I went on this journey, which helped me discover the beauty of natural medicine, the benefits of using herbs and using what our ancestors used in the past to really help us heal our bodies. So I had my baby, and I realized, although my pregnancy was pretty safe and natural, I gave birth in at the birthing center here in New Jersey. I didn't give birth in the hospital. I didn't even know I was having contraction. The day that I said I was gonna give birth, that's the day that I actually gave birth. So it was pretty nice. I mean, I manifested all me giving birth, and actually it happened. But I realized after I gave birth to my daughter that my body completely changed. Okay, in a way that I am not losing. I lost the baby weight very quickly. I have a weight loss program that I implemented for myself, that I also use for my patients. So I lost the baby weight, but losing weight without balancing your hormones doesn't really help. So I lost the weight. With me losing weight, I increased my anxiety. I also increased my depression. I look good, actually. As a matter of fact, I look like I am, what they call skinny fat, because I was so skinny during that time. I went back to work within 2 weeks after giving birth, and I felt, I thought I was doing justice to my body, but to realize that I was really creating more stress, internal stress. So I gave birth to my baby Shaquelle. I lost the weight. I saw an increase in anxiety and depression. I saw an increase in mood swings that I didn't even have before. Irritability. I would literally cry for no reason. I found like I was on a roller coaster where some days I'm super happy, other days I don't know what's going on. I just want to give up, right? Like I just want to go away, shut the business and just travel, and then they'll come back. But I couldn't understand what was happening. And then the things that I used to do to kind of bring me joy and happiness and increase my moods and wasn't happening. I felt like I also had decreased libido. My sexual drive wasn't the same. My skin was a little drier. Now I own an IV vitamin place, so therefore I have access to hydration. Even despite doing a hydration, despite doing all the things again that used to work wonderfully in the past, was literally giving me no results. So I got to thinking, what is happening? I'm not having major gut issues like I used to, like 12 years ago. I'm not having hair loss like I used to. I'm not having the symptoms that I'm accustomed to, but something is off, right? Something is off and we need to figure it out. So that's when I decided to check my hormones. I was 40 when I gave birth to my baby. So therefore at 40, throughout my whole pregnancy, they told me I was having a geriatric pregnancy. So I know with 40, society said after 35, after 38, by the age of 40 or something, you become very risky, you have a risky pregnancy. But at the age of 40, I know there's something that happens when you have, when you carry a baby, when you have birth, your hormones somewhat kind of be in balance. But again, since I was super healthy, I exercise, I do all the things, I couldn't understand why my hormones would not be balanced. So I did the blood test. I said, you know what, I have a phlebotomist. I'm gonna do my own hormone blood test. Now that was before I emerged into hormonal imbalance, menopause, perimenopause, PCOS, endometriosis. That was before I emerged into this work. So when I did the test to blood test, my results were normal. Okay, so I'm gonna pause. My results were normal, so I could not understand why I felt the way I felt. I don't understand why I'm super depressed, mixed with anxiety. I don't know what to do. My business in that time changed drastically. I wasn't motivated. Like my concentration was poor. My memory I started becoming forgetful of little things. I did not like the way I felt at all. So that's when I contacted my functional medicine representative, and I asked, I'm like, okay, what's going on? I don't know do you have a test where I can check specifically for anxiety and depression? Because I know there are some neurotransmitters involved with anxiety and depression, but I don't want to be put on a pill. I don't feel like I need to take Xanax or any medications out there. So he said, what about your hormones? I said, nope. I checked my hormones are fine. The test came back fine. There's no way I have hormone imbalance. He said, well, how did you test it? I said, well, I did blood tests, right? Because that's what you do. You take a script to a laboratory, do blood tests. He was like, well, that's not the right way to check your hormones. I said, well, there couldn't be another way because I literally did exactly what people told me. I took the blood test. He said, why don't you do a saliva testing? I'm going to do a whole YouTube video about the difference between blood, saliva, and urine. If you guys want to hear about that, let me know. I have a podcast on it, but I think you can also benefit from the video version of it. I'm going into more detail, so because that's a huge difference, and I think that's what's happening right now in the world. How doctors are doing the wrong testing and they are getting the wrong results, so therefore patients are getting the wrong treatments. Okay, so when he said saliva, which I didn't even know there was a test for saliva, because again, my focus was on gut. I do gut panel, I check for gut infections, I check for inflammation in the gut, so I know I'm familiar with this gut panel. But when it comes to saliva, I'm like, I don't know. So I said, you know what, I'm gonna do it because I don't know who this person is. I don't feel good in my body. I just want a solution. I want a result. I want to just feel like my best again. I was thriving in my business. I was thriving in my career. I had the drive, my concentration was really high. I am a high achiever, high performer. Like literally I can just outwork everybody. And then I had a baby and I didn't want to do any of that. My concentration decreased. I didn't know what was happening. So I listened to this rep. I did a saliva and he said, you know what, I'm gonna send you a kit and it's in the house, right? I'm like, okay, cool. So I would pay money for it anyways, but since he's gonna send it to me, I'm like, why not? So I did the saliva test, and I kid you not, and it's unfortunate I didn't keep the results because we changed vendor since then, and my my logins and stuff like that I don't know how to get access to that. I mean, I can if I call them, but we changed vendors. So when I did the saliva testing, I kid you not, my progesterone levels were low. My DHEA levels were low. My cortisol were high. My estrogen was okay. I didn't have to replenish or, do more estrogen. But I kid you not when I tell you my hormones were so imbalanced. And when I dig into what is the role of progesterone, which I'll do a YouTube video about that. When I really dig in, what is the role of progesterone? And I am learning how progesterone is very good for your heart or your brain. Progesterone is common, right? Now scientists are looking at ways to use progesterone for brain injuries. I did not know. DHEA is a precursor to estrogen and testosterone, and DHEA helps with moods and it helps with energy. So all these things that were super low, kind of literally, if you look at the symptoms, I had majority of the symptoms. Now I wasn't gaining weight, right? I didn't have to have flashes, I didn't have the night sweats, I didn't have the weight gain, the hormonal acne, but I have to tell you, I had depression, and I'm anxious, I'm forgetful. I didn't want to have, sexual intercourse with my partner. My sexual libido was low. So and I couldn't understand, because I literally tell all my patients, we need to have, intercourse. You need to have intimacy with your partner at least 3 times per week, right? And here I am fighting and forcing this body of mine to really, connect with my partner. So why am I telling you this? Because I know there are so many of you guys that are looking for a solution. You're looking for a solution, looking for a way to really tackle your symptoms, tackle your menopausal, symptoms. You feel like you are losing it, right? Like you're becoming insane. You don't feel right in your body. You don't know who this person is. Used to be this loving, caring, go-getter, driver, I had drive, tons of concentration, tons of motivation, and guess what? Right now it's zero. So if you feel like this and you are looking for a solution, you want results, you want answers, I highly, 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 highly recommend that you test your hormones. At my age, I'm going through perimenopause, right? So what I had to do, I literally emerged. I spent a whole year and a half behind the scenes studying all things menopausal. And that's what I discovered. There are 3 phases of menopause. You have the pre-menopause that many young teenagers are going through with the menstrual cycles. Many young people are going through with the menstrual cycles. And then you have perimenopause, 35 and closer to 50. And then you have the full-blown menopause. That's when you have no menses at all, right? No bleed for 12 months. But many of us are going through peri-menopause, and we're calling it something else. And doctors are blaming it on something else. If you're trying to lose weight and you're not losing that weight, I am telling you, you need to check your hormones first. Even if you're taking all the Ozempic out there, Wegovy, doing all the things, right, that being prescribed and, available out there, that's fine. You can do those too. But if you do not check your hormones, these things might work, and then when you stop doing them, they will plateau. You will plateau, and then you'll have to go back to the drawing board. Check your hormones first before you do any of these things. So for my perimenopause, I had to really immerse myself. I joined the North American, menopause society. I had to, because I was there's no information out there. There are tons of information out there, but I couldn't discern the information, because one person is saying one thing, one person is saying this hormone replacement therapies or cause cancer, and this doctor saying that's not true. And then you have so many people emerging bad into hormone replacement therapies, and I'm seeing my patients coming to my clinic on these products, and they are not being, how would I say this? They are not being managed properly on them. They are being left with the estrogen patch, or taking a progesterone pill, and that's it. But when it comes to hormones, and I can do a whole thing about hormonal imbalance, it is, you have to keep monitor your levels every 3 to 6 months. I will say you gotta monitor your levels every 3 to 6 months, okay? Because as those hormones are fluctuating, right, you need to see which hormones are free, that are looking for receptor sites, which hormones that needs to be latching to the receptor sites in your cells to make the cells perform or do something, right? So all of you that are taking are on hormone replacement therapies, you've never tested your hormones before, to me that's dangerous. You will not know exactly what you need to do, how you go about it without actually testing your hormones. If the doctors are prescribing without testing, it is your opportunity to say, stop doctor, I need you to test my hormones. Okay, so back to my story. So I immersed myself into my all things hormone replacement therapy. When I say menopause is hormonal imbalance, right? So I discovered there are so many things I could be doing. But the things that I discovered are not into alignment with me. I did not want to take bioidentical hormone replacement, gel or pellets or patches or pills. I didn't want to do any of that, to be honest with you. I really wanted to do things the natural way. So then I had to go back to my herbalist. I had to look for herbs for like natural that's gonna help me with the symptoms, and that's exactly what I did. So I started taking those herbs. I tried them on me. I tried them on my family. I tried them on my team, and I also had a few patients that volunteered under my supervision, my guidance, my weekly monitoring to try those herbs with me as well. So that's how I created my hormone and sex survival program, which is the program that has everything included, from testing to detox to those herbal products, right, to supplements. Since I know there are so many people that are looking to lose weight because they have hormonal weight gain, so I also have something for weight gain in there as well, something for sleep, something for your brain. When I started implementing this program, not only for myself and also for my patients, helping my patients by implementing this program, people started feeling better within 2 to 3 weeks. Brain function increased within 2 to 3 weeks. Cognitive function increased within 2 to 3 weeks. So I know this program will literally change your life if you're willing to give it what it takes, if you're willing to take actions and do exactly what I'm asking you to do, and you stay in the course, right? You're eating the food, you're following you're taking the supplements, you're showing up for yourself, you're following the recommendations. This program is awesome. That's what brought me from going crazy as a perimenopausal woman to thriving as a perimenopausal woman, because I'm about to be 43 now. So, and I'm loving my body, I'm loving my brain, I'm finding myself back, and I want the same for you. So if you are interested in learning more about how this program can literally change your life, and I guarantee it, I'm gonna put all the links below. You see all the links below, and then you can click, and then you can just schedule a call with me. I'll be more than happy to help you. Okay, so perimenopausal symptoms are not normal, hormonal imbalance symptoms are not normal, PMS symptoms are not normal, menopause symptoms are not normal. Okay, when you take care of this vessel and you listen to this vessel, you feed it what it needs, you can literally conquer all things, and you can do so naturally, with so many herbs, so many supplements. So you need to have the guidance and also the support. Okay, so this is my perimenopausal symptoms. I am so happy that you stay tuned to this video. I'm gonna ask that you subscribe, will you share it, if you listen to this on the podcast, that you share the podcast, because I want this story to reach so many people, because as we know, menopausal symptoms are terrible, and society is telling us they are normal and we should just suffer. And I'm telling you today, you don't have to suffer. Okay, there are many solutions out there. You have options. You just have to really open your eyes to the possibility of trying something different, so that you can conquer and really thrive again, regain your brain function, have more cognitive function, get rid of your poor memory, right? Get rid of the forgetfulness, get rid of foggy thinking, so you can really have the concentration, motivation, the energy, lose the weight, feel your best overall, increase your sexual drive, your libido, so you can literally be this person that you're meant to be, that you desire to be, that you were created to be. All right, so thank you again, and I'll see you on the next video.